We've all been to the doctor, whether it was for our children or for ourselves. It could be an important reason why to go, or it could be just a routine checkup. Uh, the main purpose is, for me, is good communication with nurses, considering the fact that I want to be a labor and delivery nurse once I finish school. Um, One of the most important things with your patient is to make them feel comfortable. If a patient is short and uncomfortable with the doctor and more open with the nurse, a patient's more likely to open up and explain his or her concerns to a nurse who can joke and chat with them rather than a doctor who's more likely just to tell them what is going on and leave it at that. Nurses are around more often than a doctor, so it gives the patient more time to open up and explain the full story of what is going on with them. As well, if they have any questions or concerns about what is happening, they are most likely to talk about if with their nurse rather than their doctor. A nurse communicates with the patient a lot more than a doctor. I myself have had 2 children within the past year and a half, and I've seen my doctor probably 90% of the time, and all my information is sent to my doctor. I've communicated with my nurse 90% of the time. A nurse who communicates well with their patient, who is able to joke around with them, have small talk, or have some type of bond to get to know one another, makes them feel more comfortable and welcoming. I myself, yes, I want a nurse who can talk to me about their life and make me feel comfortable, make me want to open up to them instead of feeling like I'm talking to a stranger. Making them open up will help them get the whole story of why they're feeling a certain way rather than when they're there with their doctor who asked them what was going on and they just had a short yes or no answer. Usually doctors just come in and tell you what's wrong and let the nurse handle the rest. We're all human beings and not just patients or nurses working. And that's how I want to be treated, like I'm speaking with someone I've known my whole life, and that makes it a good experience. A nurse's job is to find out the whole story about the patient, and even though they are human beings, it is important to do your job and to help them open up and make the patient feel comfortable enough to do so. For any type of nurse that is in the medical field, not just a labor and delivery nurse. Without exception, patients' experience are influenced by how care is delivered. Through communication, a patient can be reassured, be put at ease, be taken seriously, understand their illnesses more fully, voice their fears and concerns, feel empowered, be motivated to follow a medication regimen, express a desire to have treatment or not, or be given time and treated with respect. I find that extremely important. And even though my main concern is to have good communication between a patient and me, as I get into the nursing field, but it's crucial to have great communication between the nurses you work with because there are shift changes and you're not the only one who's going to be working with your patient. A patient can stay in a hospital for days or months, and you're not going to sit there and stay till they leave the hospital or get better. So you have to communicate with the people that you work with. Communicating well with the nurses you work with is crucial because it could be life-threatening to that patient. If the nurses from the shift change do not know what is going on with that patient other than just reading from a chart, it also shows that there's importance with body language and gestures you can make are important, not just verbal communication, but nonverbal communication. It's been said that over 80% of our communication is nonverbal. So it is important to focus on tone or eye contact or body gestures. Communication does not only involve talking a lot, but can be sent across with your body language, tone of voice, and gestures you make. In situations where this does occur or not occur or important information is not conveyed, treatments, medications may be missed. I actually read in an article that in a situation an oncoming nurse was not informed about a patient that had fallen before that previous shift, and the nurse therefore did not know to assess that patient for injuries or other complications from that fall, or to initiate that fall's precautions. The patient fell once again and was injured, and that possibly could have been prevented if there was good communication. Communication is essential between nurses and their patients, and it's been said that Like I said, 80% of our communication is nonverbal, and we need to pay attention to body language, eye contact, and tone of voice when we're addressing patients or even their families. I myself currently was a patient, and I have experienced good and bad communication with a nurse, and I have let it affect me in how I go about explaining what is wrong with me. To be a nurse in my future, I want to do as much research as possible so I can do the best that I can and give that patient the best experience they can possibly have, because most of the time they are a patient because there isn't something going right in their lives at that moment, and you want to make them feel better with themselves. Communication is key to providing safe care. Communication in the medical field is key to keeping someone healthy and safe. Getting across good communication with the patient helps understand all the information you need. Good communication helps that patient speak up and express their concerns. Communication failures are the leading cause of patient harm. When I get my degree, I want to do the best I can to communicate with my patient to help them open up and give them the best experience they had, so they want to come back and they're willing to get help for themselves. And I really want to do the best job I can, and I'm going to continue on to do research. And any other person out there who wants to be a nurse, I would advise you to do research and try to be the best that you can and do the best job you can and give a patient any care that they need. And thanks.